Hello, welcome to MedZone by Dr. Farjana Afrin. Today, our topics of discussion is joints anatomy. In this video, we are going to discuss about joints definition, different types of joints with their subtypes example also. So, let's start. First, definition of joint. What you understand by joints? Joints is the location of union between bones with bones or bones with cartilage or bones with enamel of the teeth or in between cartilage and cartilage where movement may or may not be possible. That means when the skeletal components are uniting, it might be bones with bones, it might be bones with cartilage, it might be bones with enamel, or it might be in between cartilage and cartilage. And second point is every joint is not movable. It maybe have movement, it doesn't maybe also have not movement. That is the definition. Next things is classification of joint. Classification of joint we can do two-way, structural classification and functional classification. Structural classification emphasizes the skeletal component in between, how they are held. If they are held with the help of connective tissue, we will say it is called fibrous joint. So, fibrous joints are held with the help of connective tissue. If the skeletal components are held with each other with the help of cartilage, we will say it is called cartilaginous joint. If the joints have a number of components like capsule, membrane, fluid and articular cartilage, we will say it is a synovial joint. So, structural classification means they have different structural elements which will be helping to hold the joints. Another classification is functional classification. Here actually we are the second portions of our joint definition more emphasizing. Functional classification time we can classify synarthrosis, that means here will be no movement. Then amphiarthrosis, slight movement, and diarthrosis there will be wide range of different axis movement. So, wide range of movement is possible here. These are the classification. Let's move more dig inside related with the joint. The first joint what we are here describing on screen you can see it's fibrous joint. So, related to the fibrous joint we have to remember the two skeletal component when they are attaching, there in between the space will be covered by densely arranged connective tissue, and in this space there will be no visible cavity also. So, it is a solid joint we can say. So, it is a solid joint, no cavity in between the two skeletal component and they are interconnected by the help of dense connective tissue. There are some subtypes of the fibrous joint. One, suture, then syndesmosis, then gomphosis. When we are discussing about the sutures, we have to remember sutures are mainly located in between cranial and facial bones. Syndesmosis, it does happen in between the two adjacent long bone. And gomphosis, it's in between the enamel of teeth and the socket of the teeth named maxilla and mandible. Let's start with first joint, that is suture. So, there are different type of sutures. First, plane. So, plane suture means the both surface are plane. The both surface are plane, and in the middle there will be dense connective tissue because it is fibrous and suture variety. So, the both surface are plane and they are held with the help of dense connective tissue. If your examiner asks you, give an example of plain suture. You can say internasal suture, or you can say interpalatine. The hard palates from both sides, they are in the midline making a suture. That is interpalatine suture. The second one here you can see over the screen is squamous suture. In squamous suture, we will see the both surface, and here you can observe one surface is beveled over another. So the surface are beveled, one is attached over the another surface. That is squamous suture. And a very good example of squamous suture we can say temporoparietal suture. Temporoparietal suture. The third suture here you can see is the limbus suture. Limbus suture, it's an example of combination of serrate and squamous. So the surface will be sawtooth type serrated. The both surface will be sawtooth type serrated, and the surface are beveled. That means one surface will be over another. That's why limbus suture we can say it's a combination of serrate and squamous. So what is the example of limbus suture? Parieto-mastoid suture. Parieto-mastoid suture. You can say occipitomastoid suture also an example of limbus suture. The fourth one is serrate suture. Serrate sutures, the both surface are serrated, or we can say sawtooth types, and they are making joint. The margins are serrated. So example we can say sagittal suture. Sagittal suture. Or you can say coronal suture also. It is also an example. Coronal suture. The fifth one you can see here, it's dentate suture. The dentate sutures, the surface are teeth-like. The surface are teeth and socket. So here also teeth and socket. So one surface is teeth-like, another surface is like a socket making an attachment. So margins are dentate, and it's quite stronger. We can say stronger than serrate suture. What is the example? Example will be lambdoid suture. The last one is scintillasis. Scintillasis, one surface will be groove, another surface will be wedge. So wedge and groove, that is scintillasis. And a very good example will be rostrum of sphenoid and plate of Vomer. That's an example. So there are different type of sutures with example. Over a screen, now you can see, as I said, the plain sutures in between the two hard palate. So plain, both surfaces are attached. We are saying it is called plain suture. You can see next image here, coronal suture. If you see the coronal suture, we can understand coronal suture is in between frontal and parietal bone. And coronal suture, it's an example of serrated suture. Then you can see in between parietal and temporal, there is a suture. It's an example of squamous suture. Again, if we want to discuss about the limbus suture, which is a combination of serrated and squamous suture, where it is in between the parietal and mastoid process. So this is the mastoid process of the temporal bone. So parieto-mastoid suture. This is the limbus suture. Another one also we said occipito-mastoid. So this is the occipital bone, and already we know this is the mastoid process. So here also occipito-mastoid suture. So this whole dark black color what I made, it is actually the combination of serrate and squamous, so named limbus suture. Then synovial. As here on the right side you can see the screen, this is the vomer and this is the sphenoid. So in between the rostrum of the sphenoid and vomer there is a joint, we are saying it is called synovial. Now the second variation of fibrous joint we are going to discuss, that is syndesmosis. Syndesmosis usually happen in between the two long bones. Now we are going to discuss about the second type of fibrous joint, that is syndesmosis. In syndesmosis, the connective tissue is converted into membrane, and syndesmosis happen in between the two adjacent long bone. We know in our upper limb there are two long bones side by side located. One is radius, another one is ulna. So in between radius and ulna, more specifically if we want to say the middle radioulnar joint, it is an example of syndesmosis. Similar, in our lower limb also there is two bones, in between there is also joint. What are the name? Name are tibia and fibula. So in between tibia and fibula there is also syndesmosis. You have to keep in mind tibiofibular joint, middle and inferior. These two tibiofibular joint are syndesmosis. The last one is gomphosis. In gomphosis we will see the connective tissue become ligament, and example is enamel of the teeth and socket of maxilla or mandible. Here we will see the connective tissue become ligament type. And what is the name of that ligament? Periodontal ligament. Name of this ligament is called periodontal ligament. This periodontal ligament, it's making connection between the enamel of teeth and the socket. So gomphosis example will be enamel of the teeth and socket in maxilla and mandible, and here the connective tissue converted into periodontal ligament. After the fibrous joints descriptions, now we will be discussing about cartilaginous joint. Cartilaginous joint also solid like fibrous joint, there is no joint cavity, and the both skeletal components will be connected by help of cartilage. There are two types of cartilaginous joint, primary or we can say synchondrosis, and secondary or we can say symphysis. Related with the primary and secondary cartilaginous joint, there are some information we have to remember. So, if we see the cartilaginous joint, first variation, that is the primary. So, primary cartilaginous joint, related to this you have to remember, in between the two skeletal component there will be number one hyaline cartilage. There will be hyaline cartilage. Then usually it is in our body away from midline. But here we have to remember a point, though it is usually away from the midline, but there is a exception. Usually in MCQ or Viva time we are asking exception and we are expecting student has studied the exception also. So the exception is joint between basi, occiput and basi sphenoid. This is the exception which is in the midline. The third point related with this primary cartilaginous joint is it is a temporary joint. So, as it is a temporary joint, that means the joints with the age will be converted into bone, and the process of this we are saying it is called synostosis. Synostosis. Then one more property related with the primary cartilaginous joint we have to remember: no movement. No movement. What are the example? Primary cartilaginous joints, a very good example we can say, in case of a growing long bone, the junction between epiphysis and diaphysis. So, epiphyseal-diaphyseal joint, number 1, epiphyseal-diaphyseal joint, and another one is, we can say in the thoracic case, first chondrosternal joint. These are example of primary cartilaginous joint. Primary cartilaginous joint when we cover, we will be heading for secondary cartilaginous joint. Secondary cartilaginous joint also have some property. Secondary cartilaginous joint, the first things we can say, there will be hyaline, then fibro, then hyaline. That means in between the skeletal component there will be hyaline cartilage, there will be fibrocartilage and hyaline cartilage. That means in between two hyaline cartilage there will be middle fibrocartilage. Number 2, we have to remember it is in midline. The location of joint is usually over midline. And as we said, it is slightly movable. It is slightly movable. So, primary cartilaginous joint was immovable and secondary cartilaginous joint is immovable. The fourth point we have to remember, it is a permanent joint. Primary cartilaginous joint was a temporary and there was synostosis, and in case of secondary cartilaginous joint is permanent, there is no synostosis. Here also one point, there is a exception. That means it's a joint, secondary cartilaginous joint, but it is not permanent. Example will be symphysis menti. So, it's in the midline in between the two half of mandible and ultimately it get fused. So, it's not a permanent joint. Give an example. Example we can say intervertebral joint. Intervertebral joint. Or one more example also we can say symphysis pubis joint. Symphysis pubis joint. Symphysis pubis joint. So, here from what are the questions we can ask related with the cartilaginous joint? Number 1, properties. Properties related with cartilaginous joint. Properties of cartilaginous joint. Or we may ask you, say the differences between primary and secondary cartilaginous joint. Or we may ask you the questions related with the exception. Now we are going to discuss about synovial joint. Synovial joint have some properties, or we can say characteristic features. So on screen you can see there are some characteristic features related with the synovial joint mentioned here. Number 1, it has capsule and ligament. Number 2, it has synovial membrane which line the inner sides of the capsule. Number 3, synovial membrane will be secreting synovial fluid which actually lubricate the joint. Number 4, articular surface will be covered by articular cartilage. Number 5, the joint has a cavity. Sometimes the cavity even may be subdivided by a cartilage. We are saying it is called menisci. You can add here one more point also. Synovial joint surrounded maybe have one structure. We are saying it is called bursa. So these are the synovial joints properties, or we can say characteristic features. One more point also we can add here. What are the intra-articular structure? Means in synovial joint, sometimes inside the joint cavity we can get some structure. What are the structure we can get? We can get ligament. Give an example of ligament. Ligamentum teres femoris capitis, or we can say round ligament of the femur. So ligamentum teres femoris capitis, or we can say round ligament of the head of the femur. We can also get intra-articular cartilage, and actually the cartilage is menisci. We also can get sometime inside the articular area muscles. Give an example, we can say long head of biceps brachii. We also can get inside the joints pad of fat. Here also we can say the acetabular pad of fat in hip joint. Acetabular pad of fat on hip joint. So these are the intra-articular structures in synovial joints we can get. Now properties related one by one we can little bit discuss. So the first property is capsule and ligaments. Let's start a little discussions related with that. So we know joints have fibrous capsule. So fibrous capsule, it is made up of nothing but the collagen fiber. So it is mainly composed of collagen fiber who are spirally arranged. What is the function of the fibrous capsule? Actually it connect the bony cartilage, bony elements or skeletal elements, or bones with bones, or bones with the cartilage. Means it's making a connection. Then we got ligaments. Ligaments, it's also connective tissue, dense, regular connective tissue. And usually we can get in our body two type of ligaments. We are saying one is true ligament, another one is false ligament. True ligament made up of connective tissue, and false ligament made up of peritoneal fold. Usually abdomen we are getting false ligament. Then we can get synovial membrane. The synovial membrane, it's also, we have to remember, it's also made up of connective tissue and it's vascular. And it has two layers, outer and inner. The outer layer is reticular and the inner layer is cellular. Synovial membrane can be of some subtypes according to the composition. What are the subtypes? It can be fibrous, it can be areolar, it can be adipose type. That's all about the synovial membrane. We also can get inside the synovial membrane secreting fluid, that is synovial fluid. Synovial fluid, it's a viscous type of fluid. It's a viscous fluid. And what is the composition? We can get synovial fluid composition: protein, hyaluronic acid, collagenous substance, synovial cell, etc. Then we can get articular cartilage. The articular cartilage, it's usually, you have to remember the point, usually it is hyaline in nature and articulate over the articular surface. But again, there are some exception. What are the exception area and why they are exception? Exception because in some area joints we will see the articular cartilage is fibrous in nature. That means fibrocartilage will be there. And what are the example? Temporomandibular joint, acromioclavicular joint, sternoclavicular joint. So, these are the joint where we can get articular cartilage covered by fibrous, fibrous cartilage, or we can say fibrocartilage. And usually articular cartilage, they are composed of collagenous tissue, type 2 collagenous tissue. They are avascular also, and they doesn't have any cartilage covering like perichondrium. So, related with the articular cartilage, we have to remember usually it is hyaline in nature. Exceptions are there. In some joints we can get fibrocartilage also, example I said. And articular cartilage is mainly made up of collagen tissue, type 2 collagen, and they are avascular, and like normal cartilage which are covered by perichondrium, it's not covered by perichondrium. Then we can say about bursa. So, bursa, it's a closed connective tissue sac, act as a cushion, pillow. When we are settle down in couch, we are sometime on the back keeping a pillow for our comfort. Same, it's also a closed connective tissue sac which contain fluid, and it's actually making comfort for our joint. How? By reducing the friction. So, it's a closed connective tissue sac and it prevent friction. Then we can also, as I said, we can get menisci. Menisci, it is made up of nothing but fibrocartilage. Fibrocartilage, and usually when the menisci is present, it will be divide the joint into multiple compartment. So these are all synovial joints property related some information: fibrous capsule, ligament, synovial membrane, synovial fluid, articular cartilage, bursa, and menisci. So, now we will be heading to see on a screen the features what just we had gone through. So, more externally articular capsule which has fibrous capsules, and inner part of the fibrous capsules have synovial membrane. Synovial membrane secretes the synovial fluid. The articular surface of the adjacent bones are covered by a cartilage, you can see here, and this is called articular cartilage. Externally, it is covered by, or the joints are held, we can say, by ligaments. Inside the joint, sometimes there might be fibrocartilaginous pad which divide the joint cavity into multiple compartment. We are saying it is called menisci. So, these are the features or properties related with the synovial joint. Now, we are going to discuss about the types of synovial joint. Types of synovial joints or classification of the synovial joints we can do different way. On screen you can see the first descriptions what I gave, that is according to the number of articular surface. So, if there is two bones attached and making a joint, simple. More than two, we can say compound. Maybe two, but with the help of articular disc, it divided into two compartments, we can say it is called complex. So, here we may ask you, give an example of simple joint, give an example of compound joint, give an example of complex joint. So, simple joint we can say simply hip joint or shoulder joint. So, hip joint, if we see the acetabular cavity of hip bone and head of the femur, only two articular surface, simply they are making joint. Compound joint, an example give, we can say about elbow joint. In elbow joint, three bones are held with together to form the joint. What are that? Humerus, radius and ulna. Give an example of complex joint, we can say about knee joint. Knee joint, the joint cavity are divided by the menisci. That's why complex joints, a very good example can be knee joint. Next, according to the nature of articular surface, how they are. On that basis also synovial joint can be classified. So, here you can see on a screen there are some subtypes written: plane, saddle, hinge, pivot, ball and socket, condylar and ellipsoid. Let us see one by one. You can see here both the plane surface are joint. So, plane surface are joint making, this is called plane joint. Give an example, we can say intercarpal joint. Next, saddle joint. The surfaces are saddle and they making joint. Give an example, fast carpo metacarpal joint. I am writing in shortcut, fast carpo metacarpal joint. Hinge, it will be door hinge like. A very good example of hinge joint we can say elbow. Then pivot, the surface are holding and in one axis one bones will be moving. So, give an example of pivot joints, we can say proximal or superior radio-ulnar joint. Radio-ulnar joint. Then one surface act as a ball like globular, another will be act as a socket. So, ball and socket variety of synovial joint. Here also we can give example like hip joint. Then condylar and ellipsoid. Related to condylar and ellipsoid, their surface behavior are same. One surface will be convex, another surface will be concave. So, both of their surface presentations are actually same. Then why we separate them? Because of the axis nature, that I will be discussing after this. So, anyway, both the surface, if we describe both the joint surface, if we see, we will see one surface is convex, another surface is concave. Give an example of condylar joint, we can say knee joint. We can say knee joint. Give an example of ellipsoid joint, we can say radiocarpal joint or wrist joint. So, that is all about the according to nature of articular surface. The third type of classification we are saying, that is called according to the movement on axis. It can be classified into uniaxial, biaxial, multiaxial. Of course, from here we can understand uniaxial means only one axis movement will be there. Give an example, it should be hinge. It can be pivot. These are uniaxial. Next, biaxial, two axis the movement will be there. Give an example of biaxial, we can say saddle. We can also say condylar. Give an example of multiaxial, ball and socket variety of synovial joint. As just before some time I said, condylar and ellipsoid, they are both surface behaving same. One is convex, another one is concave. So surface behavior is same, then also we said they are two different because of different axes. So in condylar joint we will see there will be two axis movement. One is transverse axis, another one is vertical axis. So in condylar joint we can get two axis movement as it is a biaxial joint. It can be moved on transverse axis, it can be moved on vertical axis. When we see ellipsoid, which is also a biaxial, but here their axis is little different compared with the condylar. In ellipsoid we will get there will be movement on transverse axis and there will be movement on anterior posterior axis. So axis differentiation are there. Biaxial joint they both are. They both have one convex surface, one concave surface, but the axes are different. Hope you understand this point. Now we are heading to a topic that is called Hilton's law. What is Hilton's law? Actually, Hilton's law is relevant with the clinical entity. So, by Hilton's law, the same nerve that innervate the joint also supply skin over it and muscle which will be helping to move that specific joint. So, here you can see it's a nerve. The nerve coming and supplying to the joints, supplying to the muscles which will be helping to move the joint, even supply to the same area skin also by giving a cutaneous branch. So, if the nerve get irritated, the muscles movement will be compromised, irritated, the joint will be stiff, even the overlying skin also will be irritated. That's the Hilton's law with explanation. Same there is one more, Gardner's observation. In anatomy, the Gardner's observations principle, when a part of articular capsule tightened by the contraction of a group of muscle, that specific part of the capsule receives its nerve supply from the same nerve that innervate the antagonist muscle, the muscle which is producing the opposite movement. Think like this is a joint and externally there is capsule, and this is, think like it's a group of muscle, we give the name A, and here is a group of muscles, we can give the name B. What gardeners observed are there, the articular capsule which is tightened due to contraction or due to action of the group A muscle, actually it's get innervated by the opposite action muscles. That's called Gardner's observation. So that's all about the joints related lecture. Hope so we will come with the new topics. Thank you.